Thank you so much for joining us today. So I have a question for you. If you were suffering from anxiety or depression or insomnia and you needed treatment, would it be helpful for you to go online, talk to a doctor, be formally diagnosed, and then, if needed, receive antidepressant medication in the mail? That's what this new company, GetCerebral.com, does. And they do it for $99 a month. And this is what was so fascinating to us, and that's why we wanted to learn more. So before we start, I want you to know that we are looking for your questions and comments. Type them into the chat box, and I'll make sure that we get to them along the way. So today, our guest is Maddie Corpus. Ms. Corpus is the operations manager of GetCerebral. I'd like to welcome Maddie Corpus today.
Hello. Thank you so much for having me. Hello.
It's great to have you. So I have lots of questions for you. So let's jump right in.
I'm ready.
Okay. So how did GetCerebral started? How did it get started?
So our two founders, Kyle and Dr. On, both have personal experience dealing with mental health issues. And what both of them noticed was that trying to get access to quality mental health care was just so difficult, whether that be the financial commitment involved, whether that be the wait times involved in seeing a provider. And so that really led them to develop Cerebral, where we're able to match our clients with quality providers and give them a really comprehensive care for their mental health.
So what is the idea behind GetCerebral? How does it work for people?
Sure. So Cerebral is we like to call it a one-stop shop for your mental health care. So we include video visits with a prescribing provider. Now, if they think that medication might be relevant for you, then we'll write the prescription and deliver it right to your door at no extra charge. It's all included in the subscription. And then we also offer monthly counseling sessions with a care manager. So our clients can always be learning skills that they can use in combination with the medications to give them the best outcomes.
And who is this service for? Who should use this service?
Well, right now we serve clients 18 and up experiencing symptoms of anxiety, depression, insomnia. You don't need insurance to be a Cerebral client. And so really we're just the perfect solution for adults that, are having a hard time and think that now is the time to reach out and get quality mental health care. And we're here, we're ready, and we're excited to take that journey with them.
And what kind of people wouldn't be a good fit for your service?
So, since we're a telemedicine company, there are limits to what we can do. And so, any clients that have had past substance abuse issues, if you have psychosis or schizophrenia, Cerebral might not be a good fit. We would recommend that you seek in-person care. But, we really aim to help as many people as we possibly can. And we'll even do an initial evaluation on any client. And that way we can really see if it would be a good fit for them or not.
So what about bipolar disorder?
So bipolar disorder, we are definitely able to treat. We offer the same medications that you can, that typically are used to treat bipolar disorder. We have tons of clients that have bipolar disorder, and we're still a really good fit for them because above all else, what I believe people want is, that individualized attention to their treatment plan, as well as a personalized medication plan that's going to give them the best outcomes.
Okay, so you talked about the fact that your service will do an initial diagnosis when a client contacts you. Who does that initial diagnosis?
So we have a whole wide range of providers. Our clients are able to choose which provider they'd like to see based on our website. We have all board certified nurse practitioners. We have primary care providers, and we have psychiatrists all on our staff. And then our care managers are licensed therapists, licensed counselors, licensed social workers. So really we're able to provide super high quality care for our clients with them.
So the providers then have different types of certifications, but they're all certified. And
Exactly.
So I would be able to research the person that I chose before I saw the person?
Yes, definitely. So on our website, we have pictures and bios for each of our for each of our providers, and that way you get to know them a little bit. Of course, your provider is going to be dependent on the state that you're located in, just because of licensing issues. But we'll give you a choice of all of the providers that are licensed in the state where you are, and you can really choose from there. We want you to always feel comfortable with your provider because, we really want to take a team-based approach to mental health care. And so we want you to feel comfortable with both your provider and your care manager.
That sounds great. So how is the mental illness diagnosed initially?
So before a client ever even sees their provider, we have them fill out a really thorough intake form. So whether they're coming in for depression or anxiety or insomnia, they'll be able to fill out a really specific intake form that their provider can then use to come up with the best treatment plan for them.
So they fill out an intake form and then they meet with the provider. So
Correct.
Is it the form that is getting the information, or does the provider do that?
So the form gives the provider a little bit of information right off the bat. And then they do a really thorough initial evaluation on all of our clients. And, our providers have years of experience. This is specifically what they're trained for. And so, they're able to see a wide range of clients dealing with wide ranges of issues, but still really be able to individualize the treatment plan, dig deep into the client's life. We also have the client meet with the same provider throughout the entire length of their subscription. And so really they're able to build a long-lasting and open and honest relationship with them, which is also super important for their ongoing care.
So how long does that initial consultation or initial appointment last?
So your initial appointment is 30 minutes, and you get 30 minutes with your care manager monthly as well.
Okay, so 30 and 30.
Yes.
So you've said that there are some types of issues that maybe aren't the best fit for your service. If you do end up diagnosing someone and they do have an issue that you don't feel is right for your service, what happens to them?
Some people aren't always the best fit for telemedicine, but we never want our clients to feel like we're not able to provide them resources. So even if our clients client isn't a good fit for Cerebral, we'll make sure we get them the community resources that they can use to find the right in-person care for them.
So the person would see a provider on your side, and the provider would say, you're experiencing this symptom, for example, and perhaps that's not a great fit for us. Check out these local resources. Is that what would happen?
Exactly, yes. And the client's care manager can also help assist them with that. We always want to make sure people feel supported and adequately prepared, even if we're not able to do that, we want to give our clients the resources so they can get the best possible care for them.
One additional question actually just came in, and Kelly would like to know, do you treat personality disorders?
So personality disorders are typically best treated with in-person care. We still encourage clients that believe they may be experiencing a personality disorder to sign up, get an initial evaluation with our provider. And that way, even if Cerebral isn't a right fit, we've given them enough information about themselves so they can really take the next step forward.
Okay. Okay, sorry, got a list of questions here, just going through. You've answered some of them beautifully already. Okay, so you can see your care manager every month. You get a 30-minute visit with them. Is that a video visit as well?
Yes, all of our visits are conducted via video. It's really important to us to, not have an anonymous team. We want clients to be able to see their care manager and, really build that relationship with them. And so all of our visits are conducted via video.
Do you really feel that there are any drawbacks that a patient should be aware of before deciding to try out telemedicine?
It's a great question. So I think, now more than ever, we're starting to realize the power of telemedicine. Especially because of the pandemic, people are stuck inside, and there's genuine risk in going outside to see a provider. And so telemedicine is really that a perfect way to bridge that gap of, I need care, I'm not doing well, I'm struggling, but I want to be able to do that on my own time. I don't want to be able to have to go out, sit in a waiting room. And so I think now more than ever, telemedicine is such a fantastic option to get really quality care.
And so you said that they book an appointment with the provider. Are there hours that providers work? Is there like a set business hours?
No, one of the beautiful things about telemedicine is that 9 times out of 10, if it's convenient for if it's convenient time for a provider, it'll be convenient time for a client. So we have some providers that see clients as early as 6 in the morning and as late as midnight. We operate on the weekends. We really want to be available to our clients whenever it's convenient for them.
So if you're just joining us, we are talking to Maddie Corpus. She's the operations manager for GetCerebral, a relatively new company that offers an online doctor visit for those suffering from depression, anxiety, or insomnia, or possibly other conditions. Not only can a doctor diagnose you online, but if needed, they will prescribe you an antidepressant and send it for $99 a month, the entire service included. So if you have a question, please type it in the chat box and we will get to it shortly. Same thing with your comments. What do you think about this? Would you try it? Just let us know and we'll make sure that we bring it forward. So I do have another question from Max. He says, I'm going to assume it's a he, but Max says, I always hear about people being misdiagnosed. How do you deal with that? How can Max be sure that he or she is getting the right diagnosis?
So misdiagnoses are unfortunately really common. And a lot of the reason for that is because a lot of providers just don't have enough time to build quality relationships with their providers. All they have is a medical history and, they have to go on their instinct from there. So whereas Cerebral takes a different approach, we want to know about the client's life, their lifestyle, their family history. We really want to dig deep, and so we can get the most information out of the client and make the most informed decision. So we spend so much time with our clients. We offer them not only all the video visits, but they can even chat in with any questions they have if they just need a listening ear. And so, I think that really being such a high touch company allows us to make the most accurate decisions. The most accurate diagnoses.
Absolutely. Okay. So what if the person comes in and they're a good fit for you and they start seeing you, but then on the third visit, let's just say, they have a crisis? What would happen in that kind of scenario?
Mm-hmm. So, one of the first things that we always want to do is get in contact with the client. Their care manager will be on the phone with them. We are going to use all of our best de-escalation skills. Also make sure that the client feels really supported. Our next step would be to contact the client's emergency contact, give them a real support system that can go over there and, really help them through this hard time. Of course, if anything happens, we always want to err on the side of safety for the client. And so, we may have to deploy emergency services, but thankfully we don't have to do that, or we haven't had to do that, which is really a blessing.
That absolutely is a blessing. If that were to pass, for example, someone needed emergency services because they were in a crisis state, would they continue to be your clients, or would you say now you need to get in-person care? How would you handle that?
So we'll definitely want to have a follow-up visit with them, both with their provider and their care manager. But, usually it's probably not a good fit after that point, but we always want to make sure that the client understands exactly where we're coming from and, again, give them the resources that they can have, so that they can get the best in-person care for them.
So if I'm one of your clients and I see my care manager, we have our 30-minute conversation. Does that information get rolled up to the provider, or what happens with that information?
So we have a really collaborative care model, and so we want the providers and the care managers to be completely aware of what's going on with the client, because the client may talk with their provider about one thing and then really give their care manager a little bit more insight into the past or the triggers that caused this issue. And then what we always want to do then is make sure that the provider knows exactly what's going on with the client. So again, we can always be on top of their treatment plan and make sure that that the client is always being supported and really is successful in their treatment.
So you'd say that the care manager does get in contact with the provider after a session?
Yes, definitely.
Okay. So I've got another question from Kimberly. So Kimberly is asking, what exactly is included for the $99 a month?
Mm-hmm. So for the $99 a month, we give our clients video visits with a prescribing provider. We have monthly counseling sessions with the client's care manager, unlimited messaging feature, so the client can always chat in with questions if they need support. And then the last part of what we offer, which I think is one of the coolest parts about Cerebral, is that we include medication and medication delivery all as part of the subscription. So not only are you getting the medication management aspect of mental health care, but really you're combining that with the counseling, which study after study after study has shown is really the most effective way to treat mental health.
So I know that you prescribe basically a subset of antidepressants. So mostly the generic antidepressants not are included in that $99 plan.
Correct.
So if an antidepressant that maybe isn't on the list is the one that the provider thinks might work best for the client, what happens then?
So, we're always adding medications to our formulary. Again, all part of that tailoring and individualized treatment plan. We also want to give our providers a lot of autonomy. They've trained for this. This is what they do for a living. And so if a provider thinks that a certain medication is relevant for a client, we'll do everything in our power to make sure that we're able to get them that.
So I've got another question here from Tatcha. Is it unlimited time per month, which I think you just sort of addressed? Yeah. So what's unlimited and what's limited?
So unlimited is the messaging feature with the clients, and then you get the 30-minute visit with your provider and the 30-minute visit with your care manager. And so those are a little bit more structured, but again, we always want to make sure that our clients feel supported. And so if anything ever comes up, we definitely want them to chat in. We'll be in contact with them as soon as we possibly can.
And so what is the contract term?
We never want people to feel like they're locked into a contract. And so we don't have a contract. It's month to month. And one of the things that I think is really cool is right now we're actually offering your first month for $45. So just about half price. And that way, we want you to feel comfortable, get the full Cerebral experience. And then, moving forward, you're able to receive all of that care. But the first month, we want you to feel like there's less risk involved.
And do you accept insurance?
So super exciting. Right now, we're actually working with out-of-network insurance, which is a super huge benefit to our clients. So if they meet with their provider and their care manager, they're actually able to submit a claim with their insurance company to get reimbursed for their Cerebral subscription. We're super excited about that. It's all part of our greater mission to increase access to quality mental health care.
So you're working on making it so that you will take insurance payments, or they can get reimbursed for their insurance. Is that right? I'm sorry.
Yeah, that's live right now. So any Cerebral client, new or existing, is able to submit claims for reimbursement with their insurance company, which is super, super awesome. I'm really excited about that.
That's great. Okay. So now, Ms. Corpus, don't leave us. I do want to bring on a second guest. So if you're just joining us, I am talking with Ms. Corpus, and she is the operations manager at GetCerebral, a company that offers mental illness treatment at $99 a month, including medication. And right now, I'm actually going to welcome Dr. Harry Croft on as well. Dr. Croft is a board certified psychiatrist and the medical director at HealthyPlace.
Good morning. Good afternoon.
Good afternoon, Dr. Croft.
And to you too as well. Can you hear me?
I can hear you just fine. So you've been listening to Ms. Corpus, and she's been explaining how Cerebral works. So what do you think of this concept?
Well, let me talk about the concept in general. I don't know her company. As you said, it's fairly new. Let me also say that there are a number of companies that are attempting to do the same thing, some of whom have been around a little longer. But the whole concept of telepsychiatry and therapy has been around for a while.
Okay.
And as many of the folks that are uh, uh, known to HealthyPlace will realize, it's sometimes very difficult to get an appointment. This is even before the COVID incidents, the things we're going through now. It's often very difficult to get an appointment with a psychiatrist or psychologist or psychotherapist um, uh, that's affordable or that's on the plan, whatever plan a person might have. And so telepsychiatry uh, offers an opportunity that's usually more convenient to see somebody, whether they're directly in your area or not. As many of the folks viewing know, I understand that 60% of the counties in this country don't have a psychiatrist. Uh, and so often primary care doctors turn out to be the folks that prescribe for people with psychiatric issues. Some primary care doctors do very well at that, and others don't.
Mhm.
Some seem to enjoy it, others don't. And so the idea that you could find a place uh, to uh, uh, to be able to be seen by somebody who could do an initial evaluation, prescribe medications as they are appropriate, and do some follow up is a good thing for many folks. I think we've included at Healthy Place a list of some of the companies that provide this service in addition to this one as well. Uh, I
So what
think
would you,
as with,
sorry?
go ahead. I think
Uh,
as with seeing anybody, um, you need to make sure that it's a good fit for you as the patient, that you feel comfortable talking to the person. You feel like they're listening, they understand, and they will be there to help you out, not just with the initial prescribing, but the follow up as well.
So, as described as heard today, is there anything that you think patients should know before they start looking at this service?
Well, in general, uh, the services that provide this kind of care on a fairly large basis, uh, a per month basis, um, uh, generally treat the conditions which may be bothersome and significant, but are not the more severe psychiatric illnesses. I noticed it was mentioned that bipolar disorder uh, is covered. That kind of surprises me. Usually, it's not, because patients with bipolar disorder uh, can be difficult to manage even by in-person providers. Uh, but things that may require drugs, uh, which require a triplicate prescription, things like tranquilizers and stimulants, are usually not covered under these type programs. Uh, the prescriptions that are available for the single pay in most of these services are generic drugs, uh, and generic drugs are usually fairly reasonably priced, sometimes for as little as $5 a month. Uh,
Mhm.
but I want to mention to those that are watching, even generic drugs vary widely in their
Mhm.
cost. And so while one pharmacy might charge $5, the pharmacy down the street might charge $35 or $40 for the same prescription. The coverage of drugs that are not on the list that I saw for this company under their frequently asked questions, the drugs that are usually not covered are the more expensive branded drugs. Some of the other companies handle that by charging an additional fee uh, or making the person pay at the pharmacy whatever the additional fee might be. But it although uh, uh, although seeing a psychiatrist or provider once a month may be enough, it may not be. But the good news about most of these services is they have something the equivalent of a case manager who can intervene and then talk to the provider if necessary. I didn't hear anything. If a person leaves the program, chooses after 2 or 3 months to get out of the program, uh, is there a medical record or some sort of summary that's generated so that that person, if they choose to go to another provider, perhaps an in-person provider, has some sort of record they might take?
Great
Yes.
question.
Yeah, great question. Yes, we offer all of our clients full access to their medical records, even if they choose to not continue with their Cerebral subscription. Again, we really want to educate our clients and make sure that they have all of the information in order to make the best decisions for themselves about their treatment.
Yeah,
I
and
do have I do have another question, actually. Sorry, Dr. Croft, that just came in.
right.
And the question is, can anyone use GetCerebral, or is it state-based, or who can actually use GetCerebral?
So right now we're operating in 8 states: California, Georgia, Florida, Illinois, Ohio, Michigan, Maryland, Pennsylvania, and Texas. We're looking to expand to all 50 states as quickly as possible. Again, trying to really increase that access. And so that's our main goal, is trying to get in as many states as possible. But right now, if you are a resident of any of those 8 states, please check us out.
And Dr.
And
Croft,
and
is
right
there any?
now, as many of the viewers may know, many states have relaxed the requirements of state licensure during the COVID crisis. And uh, uh, I have concerns when all this is over, what happens when we go back to normal? So I'm glad that this company is providing state based requirements for their folks. Because right now, at least in Texas, you don't have to see a provider who's based in Texas
Okay.
to qualify for some mental health care, but that's during this particular crisis.
So is there anything else you'd like to see Ms. Corpus address today, Dr. Croft?
No, I think the concept is a good one. I would encourage anybody who might be interested in this type of service to check this company out, as well as some of the other companies that offer similar services. And then there's a lot of telepsychiatry and teletherapy companies that provide some of the services, like, for example, the face-to-face services on a fee for visit basis, that might be a good fit as well. But if the choice is do nothing, then please do something to get yourself into a better position. This is a tough time, and as you know from our previous uh, uh, webinars and from some of the ones that will be coming up, this is a very difficult time Even if somebody does not have a diagnosable mental illness, they've just got symptoms of depression, insomnia, anxiety, and don't have a psychiatric disorder that requires medication, but it can still be a very problematic time and difficult time and interfere significantly with a person's life. I'm glad that companies around the country are recognizing the need for services and are starting to provide those services.
Well, thank you so much, Dr. Croft. I think we are going to leave it on that note. If you need any more information about depression, anxiety, insomnia, please go to healthyplace.com. Check us out. We have article after article on them. And I would just like to say thank you so much to Ms. Corpus and Dr. Croft for coming on today and talking to me, talking to us, talking to you, and answering our questions. Thank you so much and have a great day, everyone.